afternoon. Thank you everyone for joining us here online for our 5th week of NWI Forward Community Conversations about COVID-19. This has been an interesting series to really take a look at several different angles of how, really starting when this virus hit and, sent everyone home working remote. We've looked at everything from the initial impact and kind of short-term measures people are, how they're managing their teams remotely. So talking about adaptive leadership, we've looked at different angles as far as the education system, economic development. And today we're going to start shifting hopefully towards the back end of this, prepping for a future crisis, right? What do we do when we can move past this one and plan for the next one? So look forward to another great conversation today. These sessions are a joint effort between the Society of Innovators and the Leadership Institute at Purdue Northwest. The Leadership Institute at PNW has a couple different programs from high school to working professionals, but really training emerging leaders to grow their leadership skills, enabling participants to add their vibrant leadership to our communities. The Society of Innovators helps drive community and business development throughout Northwest Indiana through innovation. And together, we just aim to be the hub for all things leadership and innovation here in the region. So it's been a great partnership to come together officially here for these latest sessions. So as mentioned, today we have Casey Kalvaitis joining us from the Lakeshore Bone Joint Institute. So Chief Operating Officer there at Lakeshore Bone Joint, also very active in the SHRM, Human Resources Association. So wearing that hat. So we're really looking at prepping for a future crisis from that management and HR perspective. And I guess Casey, first, if you could just provide a little more background on yourself, maybe the role in your work at Lakeshore Bone Joint, but also that your role in the SHRM industry.
Sure. So I've been in operations management for almost my entire career, and I came to Lakeshore Bone Joint after a career in retail operations primarily. Although I've had some eclectic experiences, also involved facilities and insurance. And I found that all of those things lended very well to human resources. When you understand operations, you understand that operations must be fueled by people. And so people are the greatest resource, the greatest asset of every single organization. As cliche as it sounds, it's the truth. And for those of us who genuinely believe that, human resources is a natural fit. And so I came into the HR industry and I began that in retail and then made the transition over to healthcare. But the operations background was never far from my heart. And I find that HR and operations really go together like peanut butter and jelly. And that's kind of how I got into the role that I'm in here with Lakeshore Bone Joint Institute, where all things operations and human resources fall underneath my purview, amongst other things, but those are the primary components. And it's a passion for me, and I really enjoy working with people. Hope to always have human resources as something that's part of my career. And through that, like when you find your specialty like that, it's helpful as a professional to identify how do I stay current and relevant with information. I got some great advice early on in my career where I was told, become an expert in your field, no matter what your field is. Well, human resources is a very broad field, and I'd love to say that I can keep all of that information tucked away up here at all times, but having a great resource like SHRM that have very specialized human resource professionals provides me with the tools I need to research and find answers to questions that come up on a daily basis. Because some of HR is very routine, and some of it turns into the classic HR answer, which is, it depends. And so SHRM can be very, very helpful for finding the answers to those kinds of questions and providing a good resource and other experts to collaborate with and come up with the answers.
Yeah, perfect. Thank you for that, sharing a little more of your background and what you're bringing to the conversation today. And we definitely want to dive a little more into the HR specifics here later in the conversation. But first, right, I mean, from the operational standpoint, especially with Lakeshore Bone Joint, looking at really the strategies of an organization. I mean, it's safe to say 5 weeks into this, right? A lot of short-term or temporary strategies maybe have put into place at your organization. Certainly, others in other industries. But at this point, have you started to rethink longer-term strategies? What is this doing to some of your plans?
Yeah, no, that's a great question. And yes, in short, we've had to rethink our strategies. You have to rethink your people strategy. You have to rethink your operational strategy because the industries in which we work and the markets that we operate in, they're changing daily. It's so fluid right now. I've often in the last few weeks likened it to run as hard as you can right, and then stop, change directions, run as hard as you can back left, because all of the information is changing on a daily basis, and a lot of that is regulation, legislation that's coming about, and so it's forcing organizations to evaluate how do we stay relevant, how do we stay afloat in some cases, and in order to do that, it's necessary to examine what is our people strategy, what is our operating strategy. Do we need to have people here physically, or can they be doing remote work? And if you're going to make that a part of your operation, how do we manage that? And so looking at those kinds of strategies also then leads you to how are we going to do things like for us, for our patients. In other industries, it's for customers, because virtual environments are becoming more relevant than ever before. The ability to bring your services to the end user with technology are becoming very important. So for instance, with us at Lakeshore Bone and Joint Institute, we have integrated telehealth into our service offering. And that has been a close focus of mine for the last few weeks. And it's the demand that has allowed us to do that. I mean, those services are out there, but that was more of an innovative kind of thing. Like the orthopedic telehealth is a new arena. And this has changed the demand so that it's so great that we have no choice but to respond and kind of innovate as to how do you conduct orthopedic visits with telehealth. And that's what we've gone through and done, and in short order too. I mean, for any of you who have ever been involved in any sort of software implementations, just getting the agreement done can be sometimes a 2 to 3 month process, or longer depending upon the situation. So for us in this case to have gotten a fully executed software agreement in place that quickly, and then have been able to shift gears operationally to implement a service like that, it has been a very laborious process. And yet the feedback that we're getting from our patients and the fact that now we're able to put it out on our website that we can do telehealth, it's being well received, and feedback that we're getting from our patients and the convenience and the different opportunities it's opening for our business model is mind-blowing. So more and more critically for businesses, they have to look at what kinds of technology they can leverage to improve their service offering and utilize lean principles in that process.
Yeah, thank you. So it does sound like there are some areas where maybe it's you certainly changed some of the strategies. Telehealth you mentioned, right? It sounds like it certainly ramped that up. If that was on the roadmap, it's certainly what you were forced into it. And much quicker maybe than you anticipated. So thank you for those insights. And then in general, looking at, right, I mean, this crisis we're going through, and I mean, God forbid we have another global pandemic that shuts the global economy down like it has. But, in your experience, maybe as you've been building longer strategies during this time, but, just in general, what should organizations be considering when updating their crisis management plans?
I think that to adequately address that, the first thing that a business has to do is say, do we have a crisis management plan? Because if there's one thing that's happened through the course of this COVID-19 pandemic, it's been that a lot of businesses have identified that they did not have a crisis management plan. And in the absence of one, it's left many people scrambling. So the first recommendation would be put one in place. A simple Google search of sample crisis management plan will yield a lot of results. The CDC offers a number of different things. The insurance industry, so whoever your insurance partners are, whether they're brokers or agents, they can often provide a lot of resources to businesses on what should a crisis management plan, like what's a starting point, where do I even begin? But I think maybe even in advance of that is organizations really have to look at their leadership. I find that right now is a time where the best crisis management, in my opinion, comes in the form of genuine empathy and concern for employees. If leadership is not taking the time to adequately communicate what is going on, it was really the one thing I saw happening at the very start of this whole thing. The question I was getting more so than anything was, so what's going on? And it was code. It was, what's going to happen to me and my family and my work? But nobody wanted to come out and put it that way because they were fearful of how they might sound or how they were going to be judged. And that's the real question, is what's going to happen to us? One of my favorite leadership quotes is from Louis Zamperini. If you saw the movie or read the book Unbroken, and I can't find it ever again. I wish I would have saved the article, but like every time I've searched for it, I can't find the quote. But he said something to the effect of, the leader is the person who absorbs the risk. And right now, in uncertain times, individuals who are dealing with very relevant things to them and their world and their families, they need somebody to absorb the risk. They need somebody to say, hey, it's going to be okay. Here's what you need to do. Here are some options for you. And those answers maybe are not always so focused for the individual. Sometimes they're copy and paste type answers, like, here are the resources. I don't know which one is going to be a best fit for you, but the organizational leaders that are taking the time, that they're making those phone calls long into the evenings and talking through that employee who has questions about, how does unemployment work? Or what does this mean for my benefits? Or how do I change my 401k deduction so that I'm bringing more income home? I think that is perhaps one of the greatest focuses, is because if we, as we were talking earlier, if we can agree that people are the greatest asset, how you're providing attention to that asset, how you're treating people, and how you're caring for those employees, when all of this comes back full circle and we're getting back to the new normal, those are the things that employees are going to remember. They're going to remember, hey, my boss or that HR person or whoever it was, they were on the phone with me at 7:30 at night after they had worked all day, talking through my insurance deductions, telling me that, hey, it's going to be okay. Here's what it looks like. I don't know when we're going to start back up, but here's what the governor said last week. That kind of stuff goes a lot further than what organizations realize sometimes. And that's the level of leadership that's required. And so that's my best recommendation for any crisis management plan, is good leadership who's willing to roll up the sleeves. Not the type of leadership that's checking out early in the day and is unavailable.
Yeah, thank you. That's all really good stuff. And it sounds like you may have given us, a bit of this next question as far as the answers here. But looking at, the aspects of a remote workforce, again, right? This was an increasing trend anyway in the workforce, but now it's been put on hyperdrive, or we've all been forced into it, at least temporarily. So, looking at considerations companies should be making when managing that remote workforce. So, hearing you, right, some of that personal touch, checking in, it's really the mental well-being of our employees. But, what else? Even looking at more just the nuts and bolts of managing a team, what considerations should companies be making with a remote workforce?
How about, I'm going to give you guys, use the chat here. This is the one really cool benefit of virtual meetings and things that I found through the course of this is it's very easy to share information. So I'm putting something in the chat feature for everybody. This is a Harvard Business Review article that I just found last night. You should be able to just copy and paste it. And Harvard Business Review has actually made all of their COVID-19 resources free, where normally you get like 3 articles a week or something like that. You don't have to worry about that right now for COVID-19 related articles. Title of the article, The Psychology Behind Effective Crisis Leadership. One of the main things that it mentions is tell your people what will happen to their salaries, health insurance, working conditions. Working conditions meaning remote work. And another fine point that it It talks about, and this is the best article I've read since all of this started. I strongly recommend this article. It's good reading. But one of the other recommendations it talks about is good leadership, good crisis management in these times is producing policies and procedures. They're coming, they're coming out with things that are formal and written and provide a great reference and provide that structure. Over the course of my time in management, I've come to find that employees love structure. They love to know what is in bounds and out of bounds. And my personal analogy that I've always used is bowling. Remember going bowling at the, like when you were a kid, somebody had a birthday party at the bowling alley? And this may predate some people. I don't even know if they do this anymore, but I remember they would put those bumpers in the alley. And it was great fun when you were 5 years old and everybody could knock down the pins. But as you got older, bowling with the bumpers was not fun, because those individuals who became skilled and didn't need the bumpers, it wasn't fair anymore. It wasn't equitable, because the people who couldn't bowl, they could still knock down the pins. The gutters are what made bowling fun. The policies, the procedures, the restrictions are what provide people who do great work and who want to do well in the workplace. That's what provides them the ability to demonstrate their skills. And so one of the best things when it comes to the remote workforce that can go on is for leadership and organizations to develop very strong policies and procedures about what's expected, to still check in, and to utilize metrics to demonstrate when, hey, it's okay that you got up in the middle of the day to let your dog out. That doesn't make you a bad employee. It's okay that your kid ran in the middle of that phone call. That doesn't make you a bad employee. You were able to do all of those things and still produce better results than the person who maybe sat in front of their computer all day but just wasn't very motivated. So I think that having an understanding around what are the expectations and clearly communicating those, and having agreement amongst executive leadership as how we're going to manage remote work. Those are the pieces that will make it most effective.
Okay, no, thank you for that. Some great information there, and we'll definitely share that article you referenced. I see the link here in the chat. And so, managing a remote workforce, certainly that's, possible change that COVID-19 is forcing on some companies and industries. Yeah, so there's a lot packed into this next, topic, but you're really looking at, that macro level. I mean, just workforce in general. What changes or shifts are you seeing, short term versus, what may shift back to the way it was, or at least close to the way it was, and looking at short term versus long term changes?
So this is something that I think is providing the most question and uncertainty for leadership teams and businesses right now. Is we just don't know yet. There's a lot of speculation, and one thing that I am certain of that I know is coming is there will be much more regulation than ever before. I'll give you a good example. 2 weeks ago, OSHA released a 3-page update on its requirements for the healthcare industry for having healthcare providers retro or fitted for respirators. 3 pages on fitting for respirators and what the requirements are. And right now, you can't even get a respirator. So when we're seeing government agencies and we're seeing policies and things come out, when we're seeing legislation that is putting things in place that we're not even as a society, or our government is not fully equipped to fully enforce yet, the one thing we can anticipate is that enforcement is coming. With all of the different relief that we've seen that has come in the form of legislation and money, those are tax dollars. That's money that comes from somewhere, and there will be the interest in recouping those dollars. And whether the genuine interest is keeping people safe or recouping the dollars, we'll never really know. I'm sure there are plenty of conversations that go on behind closed doors, but what that makes certain for businesses is that we have to be in tune with what all of that regulation is, what it says, and what's required of us, and then make sure that we're doing the responsible things to comply with that regulation. What I have found, though, in the course of time and working with both OSHA and any of the other government agencies that are out there, is that simply putting at the forefront the concept of doing the right thing, you're able to navigate a lot of that stuff very easily. So if I'm saying to myself, hey, I need to keep my people safe, right now I am talking with suppliers about face masks cloth face masks that I can provide to all of my employees and maybe even my patients. There could be a great marketing opportunity in there as well. What if I brand them with our logo? And then my employee goes to the grocery store, or, so there's opportunities as well. But things like plexiglass shields that a lot of us have seen in the grocery store. I've got patient registration areas, and having that shield up to keep my people safe. Changing the way that our waiting rooms are laid out so that we keep good social distancing, putting policies in place that, Courtney, you've mentioned the restaurant industry and your experience there. I don't think that we'll ever see waiting areas that look the same ever again. We're going to see more situations, more app usage where people go back out to their cars and your car becomes the waiting room, and you're contacted when your table is ready, or when it's time for your visit, or when your order is ready to pick up, however it is. I know the other day on Tuesday, we mentioned what the world was like before 9/11 with travel, and security wasn't there. And now it's just become the norm. And I think what we may see for businesses are threat levels. When it's cold and flu season, you have a red threat level and people have to wear masks. And it's going to require businesses to provide more PPE, or and absorb the expense of that, or to look into possible remote work arrangements. And other things that could happen from this are, we see businesses that, of course, go out of business. We see relief for certain industries. We're going to see, at least from my own personal opinion, I think we'll see more from the gig economy. I think we're going to see a shift to the trades. There was a huge deficit in the trades. For those of you who remember the show Dirty Jobs with Mike Rowe, he's become a leader in trying to promote the fact that there are great careers in the trades. And for so long it was go to college. And maybe what we see is colleges offer collegiate programs that are trades focused, because there's a huge opportunity there. It's really difficult to say, but what I think we're going to see is new things emerge from this. And if we even look at still abiding by the ground rules, Jason, if we look at what's going on internationally, and we even mentioned this the other day with globalization, how things shake out between countries and where supply chains come from. There's a huge opportunity in our country right now to improve our supply chain domestically. And I think that that's going to present new opportunities. But one thing is for certain, and I read this today, unemployment out from term. I'll pull it up and see if I can find the actual number. But that stuff is being measured, and you want to talk about such a shift where we were prior to all of this, night and day difference to go from where we were at. 4.4 million more workers filed for unemployment. It's sheer numbers. To quantify that and just try to think about that, how do you handle the administration of that many requests? I think we're going to see more government jobs come available. There are going to be things that the government tries to go ahead and handle entirely themselves. There could be a greater bureaucracy that comes from this that provides opportunity as well. So depending upon personal views on that, good thing or a bad thing, but there will be opportunity there.
Yeah, thank you. And obviously a lot we could continue to unpack there, right? From, supply chain to government to trade workers to service workers. And so appreciate, even just a little bit of insight into some of those areas. But then specifically, right, with Lakeshore Bone and Joint, being in the healthcare industry. And I realize there may be a difference between, the true front lines of an emergency room, versus, what some of your team is working on. But I think it has been this interesting shift, right? If you look at some of these major, times of chaos, right? We think front lines traditionally through history, right? You're thinking the armed services literally on the front lines of a battle. At 9/11, we really saw, fire and police get thrust into that spotlight as far as being our frontline workers. But I'd say it's safe to say that right now, it's the healthcare workers that have taken that stance, right? I mean, or that, they were thrust into this, frontline worker, and literally, I mean, they are putting their lives at risk, but in many situations. So, from your viewpoint in this industry, I mean, what is that going to do, maybe for the demand of healthcare work, just the shift of healthcare work with a pipeline? What does this look like in healthcare long term?
I think that, so what typically happens is when people think of healthcare, they think of all of the specific, like, clinical type positions, your nurses, your doctors, and everybody else. But you don't see all of the administrative staff that is required in billing and coding and revenue cycle management, and administration and scheduling and all of those kinds of things. So as the demand continues to increase, those individuals are still, by definition, according to the Department of Labor, they're considered essential healthcare workers. And so it's kind of a wake-up call to a lot of essential healthcare workers right now who have never really considered themselves as such. But in order for those hospitals and surgery centers and private practices, in order for them to operate, they must have those positions. And those individuals are putting themselves at risk too by simply coming in, by being out there in environments where exposed people and potentially infected people are working on a daily basis. So there's going to be not just the demand for the front line, but everybody else who's behind the scenes. And what this could mean is we see more kind of pop-up locations potentially, because in order to allow for proper social distancing and in order to provide waiting rooms that aren't jam-packed, we'll see more facilities or bigger facilities that provide more space. And there's still going to be the existing need that was, I mean, there's so much out there, so much literature about the nursing shortage, the desire for physicians' assistants and nurse practitioners. And that is only going to expand more as an outcome from all of this.
Yeah, thank you. That's a lot to consider. So appreciate those insights. And you mentioned SHRM a few minutes ago, just some of the numbers they've put out. But you've kind of highlighted that organization, just one you lean on, right? Of that the expertise coming from that industry of human resources and management. During this time, specifically related to COVID-19, what type of information have they been sharing that you think others should be aware of?
Absolutely. So I'll give you guys another link, and I don't know if a SHRM membership is required for this one, but I know that a good number of their articles that are included in the section are still available for free. But the Society for Human Resource Management, being the kind of the definitive human resource has created a coronavirus section that includes coverage of the Family Medical Leave Act and what the changes are there with the FFCRA and the PPP, which is now being called P3, and the CARES Act, all of this new legislation that has come out and on some instances is long, nearly 1,000 pages. Well, there's no HR professional I know who can memorize an 880-page act. So what we're seeing is good organizations like SHRM and other employment law practices breaking that down and providing good summaries of what it really means and what the key points are and what you need to know as an organization to remain compliant. And we've actually, through the course of this, received more guidance on the Family Leave Act and how to adequately apply it in conjunction with PTO, vacation time, however the organization refers to it, than we've ever had before. So it's nice to have that additional guidance. It's helpful to HR departments, but it also produces a lot more administration and how are you applying leave, and do we have policies that directly conflict based off of those changes? And that's where you go to resource. They've also provided guidance for terminations, layoffs, and furlough, and what are the differences, and how do you need to be mindful about COBRA or the Fair Labor Standards Act with remote employees. Responding to mental health issues, this has produced incredible amounts of anxiety, large workloads in some cases, and very small workloads in other cases, and the effects of those on the human condition and people's mental constructs can be immense. And so having resources to, hey, how do we take care of our employees' mental health? we're not certain about, what the long-term effects of just staring at a screen all day are. So blue light reduction glasses are something that I've read articles about. And then SHRM also provides some good guidance on remote work and constructing remote work policies and what is considered reimbursable versus what's not reimbursable, and how do you navigate those types of issues.
Great, thank you. Yeah, definitely a good resource. We'll share and take a look at ourselves. And then, before we close this out, looking at graduating seniors, you mentioned you raised up your glasses and specifically you looked at the blue light issue. To fully jump into the Lakeshore Bone and Joint work, anything we should be worried about as we are all working from home? Things, right? I mean, making sure you're wearing shoes, because what does a month or 2 months without shoes on for most of the week look like? I mean, just as far as keeping our joints healthy, what are some concerns you would have, or advice you have for folks?
Let me Jason, you had mentioned you were a former athlete, right? So as a former athlete with old football injuries and things, it's great to have a wonderful group of orthopedic surgeons who are highly qualified. Their credentials are impressive, and to interact with them and understand their motivations for helping people is even more impressive. But their guidance, and including the guidance of a clinical psychologist that we have on staff, is mainly to move, get up, move, stretch. Don't neglect the cardio. I just got this advice from one of the doctors the other day, is like, as I've been working a lot, make sure that you're still getting that stuff in, and what the effects are mentally for you there. But to try to neglect that stuff, it's very scary. Some more good reading, a fantastic book that I had recommended to me just over a year ago, a book called The Ripple Effect, that talks about how just small changes in breathing and mindfulness and watching your diet, how all of those things equate to benefits in other areas of your health. How if you're experiencing sleep deprivation, it could be a function of having had too much blue light and staying connected too much to devices, or having not been physically active enough. Fantastic book, but I think those are very, very good, simple rules. Watch your diet, stay active physically, be mindful, practice some breathing, and especially in periods where you're feeling very stressed, and try to laugh, have some fun with it. Right now, with all the tension and all of the negativity that you get, especially when you turn on just the basic news, it can be helpful to put on a comedy and have a laugh or something. The best insight I can provide.
Okay. Yeah, no, thank you. And I think it will be interesting, the ripple effect of, the hardware and housewares industries, looking at home gyms and home offices. There's certainly going to be an increase in some of those, products and remodels, most likely. First and foremost, I certainly miss the chair I regularly sit in my office. The folding chair I'm using does not cut it.
Definitely. Ergonomics.
Absolutely. And so finally, and I know we're kind of at our time here, but we didn't want to neglect this last topic. And again, I know it's a lot to unpack in this, but we were talking offline a bit before we really jumped into our conversation with you, of looking at the impact of graduating seniors, right? I mean, we talk about workforce, certainly one of the most definable or captive, pipelines to industry is our graduating seniors every spring. But, from everything to interviews on campus to, maybe final, spring internships. I mean, what are some of those impacts of seniors, and, any advice you may have?
The hardest part for me is that I enjoyed my senior year so greatly, and the experience of all of it, that, my heart bleeds for the seniors who don't get that experience and what they're missing out on. And we don't even really know what the full impact of that is just yet, and how those individuals will deal with that loss, because really it is lost. Missing out on an experience that people have worked hard for a long time. And yet I think through the course of that, we'll see individuals who build a lot of character and who persevere. And I think for those individuals who have the can-do attitude, who are going to say, hey, no, I will find a way, we're going to see them continue to network and find those opportunities and look for those opportunities. And some of it is self-marketing and personal branding a lot of which I know our earlier discussion kind of involved utilizing LinkedIn. But it sounds like Purdue offers a great program, Jordan, that you described for me, and what a wonderful resource. And drawing on the skills that are developed and the education that's obtained through a program like that, as to how to construct a resume and how to lean on those interviewing skills, even if it is a digital interview and it's not face-to-face, making certain that they don't lose track of those types of skills and rely on faculty, staff, and individuals who are really there as a resource to help them through and find that first career opportunity. That is the best advice I can give. And for anybody who maybe views the recording or who's present on the call, I welcome you to look me up. I'm on LinkedIn and I do respond to messages. And I prioritize all of those messages for individuals looking to network over the massive amounts of marketing messages that I get. Individuals looking for assistance or looking for opportunities. What a great way to help each other. I had a supervisor at one point in my career who was very, they always repeated the phrase that they lift higher, or they rise higher who lift as they go. So people looking to help other people is going to be how success is found. And so if anybody's looking for help or guidance, please reach out to me. I'll do whatever I can.
Great, thank you. Great thoughts to close us out. So Casey, thank you so much for carving out the time to share some of your insights. I know we flew through some of that. We'll make sure to share some of the additional resources that you provided here from Harvard Business Review and the Society for Human Resource Management. So thank you for that tip on sharing some of that. But yeah, we just appreciate you taking the time.
I'm very grateful for the invite. It's been a wonderful conversation.
Thank you, Casey.
And this was awesome.